This video was created to introduce the current status of research on genetic mutations in cerebrovascular disorders at the Department of Neurological Surgery at Nippon Medical School. In particular, we will report the current status of susceptibility gene research for Moyamoya disease and the latest research results on the relationship between RNF213 gene mutation in intracranial vascular lesions. This work was supported by the following JSPS grant. Moyamoya disease is a common disorder in young female Asians. The disease is characterized by bilateral stenosis of the terminal portion of internal carotid artery and an abnormal Moyamoya vessels that is a collateral pathway. A single missense mutation in ring finger protein 213 has been detected as a disease susceptibility gene in Moyamoya disease, and its relationship to clinical syndromes has been noted. In this presentation, we will report on our team's recent work on RNF213. The three main points are as follows. 1. Significance of RNF213 in the diagnosis of Moyamoya disease and quasi-Moyamoya disease. 2. Expression of RNF213 in intracranial internal carotid artery saccular aneurysms. And 3. Involvement of RNF213 in congenital occlusive disease of the internal carotid artery and middle cerebral artery. First, we present our findings on the significance of RNF213 in the diagnosis of these diseases. Quasi-Moyamoya disease is Moyamoya disease complicated by an underlying disease. There are a wide variety of underlying issues, which are listed here. It is known that medical therapy, such as hormone level correction and immunosuppressive therapy, can be effective in some cases of the quasi-Moyamoya disease. Therefore, the objectives of this study were as follows: to compare the frequency of expression of the RNF213 14576G to A mutation between Moyamoya disease and the analogous Moyamoya disease, and to clarify the significance of genetic diagnosis in the diagnosis and classification of these diseases. Patients with these diseases were included at our institution and affiliated institutions. This RNF213 variant was investigated using high-resolution melting curve analysis. We looked at the age of onset, sex, mode of onset, family history, medical history, and frequency of the mutation. Screening of this genotype was performed by small amplicon genotyping based on high-resolution melting curve analysis and confirmed by Sanger sequencing. The results of the 86 eligible cases are shown. There were no statistically significant differences in the frequency of RNF213 between the two diseases. There were also no significant differences in clinical symptoms, in gender, age, or family history. The following are the characteristics of 10 cases of the quasi-Moyamoya disease. The characteristic feature of quasi-Moyamoya disease noted in the study is that many of the cases had coexisting thyroid disease. The following are the characteristics of the clinical syndrome in terms of the presence or absence of RNF213 expression. No items showed significant differences. Compared to previous reports on quasi-Moyamoya disease, we found a relatively high frequency of RNF213 mutation expression. This may be due to the inclusion of a large number of hyperthyroid cases. It is possible that Basedow disease-associated quasi-Moyamoya disease may be a genetically similar disease to Moyamoya disease. This RNF213 mutation indicates a possible need to classify the analogy Moyamoya disease according to the underlying disease. Next, we present our findings on the significance of RNF213 in internal carotid artery saccular aneurysms. We analyzed the RNF213 mutation of internal carotid artery saccular aneurysms and, as controls, atherosclerotic carotid stenosis. In this study, the diagnosis of internal carotid artery saccular aneurysm was strictly differential diagnosis based on 3D CT and MRA, as well as surgical findings and angiography for cases smaller than 5 millimeters. In addition, we obtained history of infection, tumor, head trauma, and family history of Moyamoya disease in order to exclude secondary aneurysms. The clinical type and location of cerebral aneurysm were also classified. Here are the results from a comparison of intracranial internal carotid artery aneurysms and stenosis. Hypertension, diabetes, and male cases were statistically significantly more common in stenosis. 12.2% of 49 patients with aneurysm and 13.6% of 22 patients with carotid artery stenosis had RNF213 mutations. The risk of RNF213 mutation was not significantly different between aneurysms and stenosis. The study was limited to patients with cerebral aneurysms, and RNF213 expression was examined in relation to the site of aneurysm, age, and gender. However, no significant correlation was found. We also examined the expression of RNF213 and clinical type, multiplicity, and pre-existing disease. No items were significantly correlated. The frequency of the RNF213 mutation expression is around 2% in Japanese patients without intracranial vascular lesions, and is similar in all cases of cerebral aneurysms regardless of site or morphology. Similar to the case of intracranial vascular occlusive disease, RNF213 expression was higher than in previous studies when the etiology and site of cerebral aneurysm was limited to the intracranial carotid artery. The possibility that the RNF213 mutation is involved in intracranial carotid artery saccular aneurysms was demonstrated. More rigorous lesion diagnosis and vascular site of origin should be performed. Next, we present our findings on the significance of RNF213 in internal carotid artery saccular aneurysms. RNF213 susceptibility gene expression is reported to be about 85% in Japanese and Korean patients with Moyamoya disease. It is also reported to be 15% or more in East Asian patients with atherosclerotic internal carotid artery stenosis. The purpose of this study was to determine the frequency of RNF213 mutations in congenital occlusive vascular abnormalities in ICA and MCA. Congenital occlusive vascular dysplasia of ICA and MCA diagnosed by cerebral angiography was included. Cases with an underlying complication of or a family history of the quasi-Moyamoya disease were excluded. 9 cases of congenital occlusive angiogenesis were included in the study. 5 patients had dysplasia of the internal carotid artery and 4 had dysplasia of the middle cerebral artery. The RNF213 mutation was not detected in any of the 9 patients. Here are the details of the case. Several of the cases showed a twig-like MCA abnormality. 3 cases had headache and 3 cases had ischemia. There have been no previous reports of RNF213 mutations in congenital angiogenesis imperfecta. The results of this study may help in the diagnosis of angiogenesis imperfecta of the internal carotid artery system in the future. We've published 3 papers on these findings. This paper covers the first major finding we discussed previously. This one covers the second major finding. And this one covers the third major finding. Thank you for listening.